Hello, my name is Dr. Lindy Thauberger. I'm the head chiropractor here at Thrive Wellness and Rehab in Lexington, South Carolina. What I'm going to do today is actually impart a little bit of my knowledge I've learned over the last 17 years of being a chiropractic physician. More namely, what we're going to cover today is going to be allergies and pollens, which is what we're suffering with here in Lexington. Every year we wind up getting a dump of pollens around February and March, and we have so many people that suffer with allergies and pollens out here. I used to be one myself, not so much anymore, so we're going to teach you some ways you can get your body working better so you actually don't have to suffer through these allergy seasons. First things I say to my patients, you have to understand what's going on outside. Outside is in the January and February months, it gets a lot colder, and because it gets colder, that hydration in the air will actually start to coalesce and drop down to the ground in the form of rain or snow. And unfortunately, it dries out our atmosphere, and because we live in this biome, we're going to acclimate to it, and we're going to get dry also. So what you want to be looking into is hydrating your body about 2 to 4 liters of water per day, every day, and that's going to be dependent on the size of the person and their physical activities. So if I'm bigger in stature, if I'm more physically active, if I'm in a hotter environment, I'm probably need more water. If I'm not big, I'm not physically active, I'm not in so hot an environment, I probably won't need as much water. But that's going to be for the average individual. Now, if I drink things like coffee, pops, soda, tea, alcohols, what you want to be looking into is you want to counteract those things because those things have components in it, caffeine and alcohol, that your body doesn't like. So you're going to use your own precious water to flush those things out of you, which will dehydrate you in the meantime also. So for every cup of coffee, pop, tea, alcohol, you should have 2 cups of water to counteract that. If I have 12 ounces of coffee, I should have 24 ounces of water to counteract what I've just done by having that coffee, and that's above and beyond the 2 to 4 liters that we talk about per day. The other thing you want to be looking into is increasing your oils, your good oils, olive oil, flax oil, fish oils, or great omega-3s. And what those things do is a lot of different jobs in your body, but the ones we care about are the ones from the adrenals. You can make prednisone and corticosteroids, which are anti-pain and anti-inflammatory hormones. If you make more of those in your body, you get less pain and inflammation. So when you get the dust, dander, or the pollens into your body, they hit into your nose and your eyes. What that's going to do is it's going to agitate them. You get that irritated response. You might want to scratch them. This will actually reduce that inflammation. You don't have to suffer so much that way. Now, what's happening inside the body is that here's the symptoms you'll normally see. You get little crusties on your eyes in the morning. You probably notice you get some nasal discharge as a mucus, and at the same point, you're going to notice that your nose will close off from one side to another side. What's happening on these sort of things is your body's trying to save itself from actually drying out. If you put 2 opposing skin surfaces together and you actually hold hands with somebody for an extended period of time, pull your hands away, what do you notice happens to them? They're going to be more clammy. At the same point, that's moisture on there. So you have 2 opposing skin surfaces together, you're getting moisture between them. So that's what your body's doing to try and save itself. It says, these tissues are thin in my nose. As I breathe through them, they're going to start to dry out. So I want to save these tissues from getting irritated and damaged or possibly killing them off. So what you'll do is you'll actually go and close off the tissues on one side to hydrate those tissues as you're breathing through that one side. Then you're going to swap it out in half an hour so you can breathe on this side so these tissues don't get damaged. So you'll open this one up and you'll close that one off. You do it another half an hour, just undulate back and forth. And this is what your body will do over and over again, but after you do it just one duration, you don't pay attention to it anymore, so that's why we don't think about it. But that is a sign of dehydration. So if you boost up your good oils and your good water, what that's going to do is lubricate these things so you don't actually have to suffer so much and get your lubrication from the inside to the outside. And that's how you get hydrated. Inside water content will go to the outside and make you lubricated. So if you work on these sort of things, I've had hundreds if not thousands of people get well on these sort of patterns. Do it yourself, see how it works for you. And if you liked what we just told you here, give us a thumbs up. You got some family, friends that suffer from these things too. My suggestion, send this out to them too. Help share with them. Help them not suffer through these allergy seasons. You love the content we're giving? Come back. We're going to try and get you out new content as soon as we can. Have yourself a great day.